Good morning, students. Today's topic is about anesthesia for disorder of blood. Introduction. Blood disorders can significantly affect oxygen transport, coagulation, and the response to anesthesia. Proper preoperative assessment and correction of abnormalities are essential to prevent complications during surgery. Common blood disorders are anemia, hemophilia, thrombocytopenia, leukemia, sickle cell disease, thalassemia, and other coagulation disorders. First, preoperative assessment, history, type and severity of blood disorder, previous bleeding episodes, previous blood transfusions, previous anesthetic complications, medications, especially anticoagulants and antiplatelet drugs, history of infection. Next, investigations, complete blood count, hemoglobin and hematocrit, platelet count, PT or INRI and APATT, blood grouping and cross matching, peripheral blood smear when indicated, renal and liver function test when appropriate. Next, anesthesia in anemia. Anemia reduces the oxygen carrying capacity of blood. Anesthetic considerations are determine the cause and severity of anemia, treat significant anemia before elective surgery when possible, ensure adequate oxygenation and ventilation, avoid excessive blood loss, maintain adequate circulating volume and cardiac output. Oxygen supplementation may be required. Blood transfusion is considered according to hemoglobin level, symptoms, clinical condition, and amount of blood loss rather than by a single HB value alone. Next, anesthesia in hemophilia. Hemophilia is an inherited coagulation disorder commonly due to deficiency of factor hemophilia A or the factor 9 hemophilia B. Anesthetic considerations are consult hematology before surgery, determine factor level and inhibitor status, replace the deficient coagulating factor as indicated, avoid unnecessary invasive procedures, avoid intramuscular injections, avoid traumatic airway instrumentation, and regional neuraxial anesthesia should generally be avoided unless adequate factor correction and specialist guidance make it appropriate, and ensure meticulous hematostasis. The next one is anesthesia in thrombocytopenia. Thrombocytopenia means low platelet count, increasing the risk of bleeding. Management, find and treat the underlying causes, check platelet count before surgery. Platelet transfusion may be required depending on the platelet count and procedure and bleeding risk. Avoid unnecessary invasive procedure. Avoid drugs that impair platelet function when possible. Neuraxial anesthesia require careful assessment of platelet count, trend and cause. Next, anesthesia in sickle cell disease. Sickle cell disease can cause vaso-occlusive crisis and tissue hypoxia. Anesthetic goals: maintain adequate oxygenation, maintain normal hydration, avoid hypothermia, avoid severe anemia, avoid acidosis, avoid hypotension and low tissue perfusion, prevent infection and excessive physiological stress. Next, general intraoperative management, monitoring ECG, BP, SpO2, capnography and temperature, maintain adequate oxygenation and tissue perfusion, maintain normothermia, minimize blood loss, maintain adequate blood fluid balance, use blood products appropriately, maintain meticulous surgical hemostasis, avoid unnecessary traumatic procedures, monitor coagulation and hemoglobin when indicated. Postoperative management, monitor for bleeding and hematoma, monitor hemoglobin and platelet count when required, adequate oxygenation and pain relief, continue required factor replacement or other hematological treatment, watch for infection and thrombocytic vaso-occlusive complication, early recognition and treatment of complication. Conclusion: patients with blood disorder require individualized anesthetic management based on the type of disorder, hemoglobin level, platelet count, coagulation status, and planned surgery. Proper preoperative optimization, careful anesthesia, blood product preparation, and close postoperative monitoring help reduce bleeding, hypoxia, and other complications. Thank you.